which season is more suitable for hair transplantation? Emir sen git ya.
Vallahi.
Bence de abi senin moralin bozuk. Question 16 is, can I wear a hat after the procedure?
İzlesen bir tane videoya gitsen sonra.
Oğlum izleyeceksin, hepsini yayınlanacak bunları.
Ameliyattan ne zaman sonra içeceğim hocam alkolü?
Of the surgery, but the next day, okay, for sure, you can do better if you do your shot. So, hello guys, this is Dr. Bircan, and I will be answering all of your questions, hopefully, as long as the questions make sense. Okay. So, how we start? So, I will take first one, and then we'll see this. The question 16 is, can I wear a hat after the procedure? So actually, after hair transplantation, the implanted zone is so much important that should be protected very carefully in terms of the touch. Anything shouldn't touch in that area. So any hat that we use that could touch the implanted zone is forbidden actually. I mean, this is for the 10 days after the surgery. So we will give you a hat which is wide enough put on your head, but that doesn't touch the implanted zone. So in the first 10 days, you will be able to use that head. After that one, you can use whatever you want. Still, you will be careful until first month. So yeah, actually, the hat we gave you can use, but the regular hat you will be able to use after 10 days. So the question 14 is, which season is more suitable for hair transplantation? So look, actually after hair transplantation, first month is so much important to keep the scalp pH in the balance level, which is 5.5. So the things that could change the pH, kind of excessive sweating, which could happen under the sunlight, maybe staying in a hot weather under the sun, could change because of changing excessive sweating. Other than that, maybe swimming in the swimming pool or in the seawater could change the pH of the scalp because of the chloride water or the salty water in the sea. So if we would think which season is more suitable, maybe other than your vacations, like going to swim or sunbath, could be any season, could be okay. In terms of results, actually we would get in all seasons we would get the same result as long as you don't go to sunbath. So any season is okay for that. Biraz karışık oldu, a little bit complicated answer, but the one who knows the answer will understand the answer. So hopefully we have another easy question. How long should someone abstain from alcohol after their hair transplantation? So about alcohol after hair transplantation, yeah, the patient has to be avoided a little bit from the alcohol just right after the surgery because they are having antibiotic treatment to prevent potential infection in the scalp tissue from the donor area or the implanted area. So as we know that alcohol would lower the effectiveness of the antibiotic, so we advise them not to use alcohol while they are in antibiotic treatment. Before hair transplantation, the day before surgery, we would not recommend again, which is a kind of blood thinner to protect from them to bleed a lot during the surgery.
Ameliyattan ne zaman sonra içeceğiz hocam alkolü? 3 gün sonra, 5 gün sonra.
Ameliyattan sonra buna da cevabım yok aslında ama espri de yok. Komik de değil. Yani ameliyattan sonra, brojum ameliyattan 2-3 gün sonra en azından, yani antibiyotik bitmeden içmemek lazım. Yani çünkü antibiyotiği de etkileyecek yani. When can I take a shower after hair transplantation? So actually you can shower immediately after because yeah, we are doing your hair transplantation. We're working on your head, on your scalp, and if you will have a shower, you can you can do shower from under your neck, the body. That's fine for sure. Maybe you don't stay so long in the bathroom. That wouldn't be so much warm to affect the transplanted zone. Maybe the best thing is not to have a shower the day of the surgery, but the next day it's okay for sure. You can do better if you do your shower. 23rd, is your hair natural or did you have a hair transplantation? Actually, I have this question when my patients come to clinic, when I do the consultation. Of course, when we come to face-to-face, they really wonder if I did a hair transplantation. The answer is actually no. Because I am lucky genetically, because my father's side, my mother, brother's side all has good hair. We don't meet each other so much, but last year I saw one of my mother's brother. He really has good hair. I saw it.
Yes.
Actually, from
You are very handsome hocam.
the next question is, what is the FUE Sapphire technique? A long question. Actually, almost all of my patients know the answer before coming to hair transplantation. Maybe more than 95%, maybe 99% of my patients already know what is FUE Sapphire technique. So, if I would answer this question in another way, that where did Sapphire come to the hair transplantation industry? As you know that when we extract the hair follicles, we implant it to the holes that we open in the recipient area. So people used to open these holes with very tiny needles, but in that time it was very difficult to put follicle in it. The follicles were bending itself, so the survival rate were so less, so they wanted to make it a bit bigger needles. But at that time the wound healing was not very nice, very good, because it was a kind of circular. So they changed it to the metal slit, that you could be able to cut it depending on the size of the follicle. So you arrange depending on the follicle size. It was really helpful, really useful. But the last few days, last few years, and the industry started to produce sapphire knives, which is very sharpened. When they were sharpened, the wound healing was awesome, much better compared to the metal slits. So when we implant any follicle in it, the wound immediately heals. So the follicle is able to get the blood supply so quickly, so survival rate was higher. And the thing with the sapphire was, it was very difficult to open the holes with high density, but by the time when the nurses, doctors got practice doing the sapphire, they started to produce a thinner sapphires, which is really useful to make higher dense, and which is very beneficial for wound healing. Actually, we have been using in our clinic since many years. Compared to the metal slit that we can see already, the skin quality after maybe 1 or 2 months is visible with the sapphire, which is much better. But metal slit is still nice, still good, it's useful actually. 8. Can hair transplantation be done under sedation? So actually, sedation is very nice for the people who has phobia of the needle, of any kind of surgery or any kind of pain. For them, we just give them anesthetic here from the IV catheter, but we don't put any tube in their mouth. Of course, we don't touch their respiration system. Sedation is the thing that you just sleep. You feel like sleeping, and then you forget what's happening last few hours. So don't confuse it with the general anesthesia. Why I explain this is that there is a huge difference in terms of the medical risks between each other. So when we give the sedation, even though they feel they understand what's happening here in terms of pain during the local anesthesia, they wouldn't remember it afterwards. And most of the patients who have sedation before surgery doesn't feel anything, any pain. They have no idea what's going on. And we don't prolong the sedation so long, more than 4 or 5 hours, because there is no need to take that so long risk. So for the first few hours, where all local anesthesia done, where the most difficult part of the surgery is, could be taken under the sedation. What are the risks of the sedation? In 2022, to be honest, there is no such a big risk, but according to my experiences in my clinic, we are doing all surgeries in a JCI accredited A+ hospital with all facilities, so we are already minimizing all the risks in any case, so sedation is almost nothing to talk about. Yeah, we can do for sure. The next question. The first question: how many days should I sleep in an upright position? How many days should I sleep? Yeah. The right after the surgery, the donor area, we don't have any problem with that one. You can touch the pillow, you can touch here. Actually, there will be bandage right after the surgery, but you can be relaxed with that one. So you don't have to sleep upright. You can sleep on your back. As long as you protect your crown area, if there is any implanted hair here, as long as you protect it not to touch the pillow or the bed, then you can lay on your back. And you should protect the implanted area next 10 days. The pillow, a bed, or anything shouldn't touch that area. So the answer is 10 days. 7. Is planting done only with the roots taken from our head, or can we use chest hair as well? Actually, the question before I answered this question as well, chest is the same, that we don't have very high density, that could any marks, any incisions could be seen postoperatively, so not very good place to extract grafts as a donor area. And the other reason, according to studies, it survives at around 6 or 7 years if it would grow. According to my experience in our clinic, we use, not commonly, but maybe like around 7-10% of our patients, we actually use donor area chest as a donor area. So yeah, it grows for the next few years, but to be honest, I didn't follow my patients like more than 10 years or something, so I don't know if it continued their life circle in the transplanted zone. Emir, sen git ya.
Vallahi.
Bence de abi senin moralin bozuk, bizim de moralimiz bozuk. So the question for is, who cannot have a hair transplantation surgery? Actually, the one who doesn't have any hormonal disorders or any additional condition which would cause a hair transplantation cannot have hair transplantation prior that he had a previous treatment. For example, some thyroid dysfunctions, or for the women who has some kind of prolactin disorders, prolactin releasing hormone disorders, or any deep deficiency of the vital vitamins for the hair follicles. And yes, actually, for example, who would have chemotherapy or who already had chemotherapy, which cause the blood vessels occurrence or restrictions in the scalp tissue, wouldn't have benefit with the hair transplantation for some period of time. We already had a patient who 2 years ago had a chemotherapy, last chemotherapy, we did hair transplantation, which he had really good result, but we have to ask the patient if the treatment will continue or when did the last treatment was, so it affects the result itself as well. 22. Which shampoo you use to wash your hair? Me, myself. So actually, Kerastase has pretty nice kind of shampoos that I tried before, and I sometimes use it. And the Davines is really good because it is organic shampoo. And other than that, I would prefer regular shampoo if I would have a hair loss, because these shampoos doesn't help to protect my hair stronger. I use these shampoos not to protect my hair stronger, but if I sometimes if I would have some kind of skin dandruffs or any kind of things, I change my shampoo. But if I would have a hair loss, I would use a regular shampoo, which includes a medical shampoo, regular medical shampoo, which includes some kind of vitamins like biotin, zinc, which is not so much beneficial for scalp or hair follicles, but still I would hope some benefit from that shampoos. Other than that, any chemical ingredients, any shampoos which are like kind of which includes any salt in it, I wouldn't recommend you. And we don't have so much expectation from the shampoo actually. If it just cleans the hair, that's enough. Even the foam we don't need. That's my answer. Last question. Are Turks the best hair transplant doctors? Are Turkish doctors, should be the question. Are Turkish doctors the best hair transplant doctors in the world? Really interesting question. As you know that I am an ISHRS member, so I would say that of course the American doctors, we have lots to learn from them, as they know for sure the UK doctors as well. I mean, it's not about the doctors, it's about the teamwork. So maybe you wouldn't say that is it the best? Is the best football players are English or let's say Spanish? The answer would be no for sure, but they are the best. Maybe the Italians, for example, they are the best who creates the best team in football player, as a football player. So maybe the Turkish doctors are the best to create a hair transplantation team. Very qualified, very like with the discipline, experienced. As you know, during the corona situation, there were lots of news. Maybe you came across one of them, that Turkey medical service was really good. Maybe if you heard any, because the medical culture is really good in Turkey. So to create a good team, a nurse team with all facilities inside the hospital is a big advantage in Turkey. That you can create a good team. So we should look in this perspective, not about the doctors. As you know, I had education in Turkey. I graduated in Istanbul, Faculty of Medicine, but I had very good experiences in the Cambridge University Hospital or in the America, in Columbia University Hospital. So I had the opportunity to see a world, like kind of medical perspective around the world, worldwide. So I met many doctors from the Europe, even Australia. I had a very nice friend all around the world. So what I could see that there are lots of experience, lots of hardworking, productive doctors even from the India, China, Germany, in all countries. So it's not good to compare the doctors, which doctors are the best, but I would say that the Turkish team might be the best in the world. And I wouldn't forget to say that facilities of the hospitals are so much important. I mean, all equipment, all teams should be qualified at the same level. For example, a hospital should give me the guarantee that I am safe, my patient is safe in any case, and the product itself, the materials I'm using is sterilized. Everything should complete one with each other. So it's all, if you look in a wide perspective, it's all teamwork and all facilities. So Turkey is a good place for you to choose for hair transplantation for 2022. And guys, thank you so much. Actually, this is my kind of a bit late time after the clinic, so I'm very happy to see your questions. I would like to answer more and more. But of course, we have some questions here, but I will collect some more from you during the Instagram page and the YouTube page for sure. Wherever you ask through the WhatsApp, just follow your questions to me. I will be honestly answering your questions all the time with my best. So don't